Hey there, did you know that you can floss the sciatic nerve? Hi, I'm Dr. Kevin Lewis, your local Greenville wellness and injury expert. And I had a patient this week that was suffering from sciatic nerve pain, and he asked for a stretch or an exercise he could do at home. I thought I'd tell you about this exercise that you can do for sciatic nerve pain. So the sciatic nerve is the largest nerve in the body. It runs down the back of the leg. The nerve roots that come out of the low back and the sacral area form the sciatic nerve as they go underneath and through several large muscle structures in the buttocks and the leg. And then when it reaches the knee, it splits into two portions, one for the front of the leg and one for the back of the leg, and those nerves continue on down, controlling those muscles, tissues, and structures. And so the sciatic nerve controls everything from the hips on down as it supplies those nerve roots. The sciatic nerve can become impinged along its path. Now, if it's in the low back from a bone out of place, one of the vertebrae out of place, or the disc, then that needs to be treated by a professional in the office like we do here. But if the impingement is further down in the back of the leg, you can actually do this simple stretch to help alleviate sciatic nerve pain. So I've got Kaylee here, my office coordinator. She's going to help demonstrate a couple stretches that you can do. Now, first of all, one way you would want to reproduce that pain is you could be seated like this, or you could even lay down. And I'll have Kaylee extend her leg. Extending the leg stretches the sciatic nerve, causing tension on it. And if there's an impingement or an adhesion to the sciatic nerve, it'll reproduce that pain, which will be more of an electric shock-like pain under the back of the leg, maybe even going all the way down to the foot. So we'd want to extend the leg to the point that the pain just begins and back off from there. And then the stretch, I'll have Kaylee bring her chin all the way down to her chest. As she brings her chin down, since the nerve roots come from the spinal cord, it will raise the spinal cord, tensioning the sciatic nerve all the way down, kind of like floss, and it'll pull it forward. And then she can look all the way up at the ceiling, allowing the sciatic nerve to slide back down under this tension. And then she can come back down towards her chest again. And as she does this exercise back and forth, the sciatic nerve will move back and forth with the spinal cord, allowing those adhesions to break up and allow it to come free. Okay, you can stop. And what that's going to do there is allow those adhesions to break up, allow it to come free. You would, again, stop the movement at the point that the pain begins. Now, once we've got that down, we can extend the stretch even further. As you can see, if Kaylee were to point her toes up, that would stretch the sciatic nerve even more. And now, as she stretches her toes up, she can look up at the ceiling, okay? And that's going to pull it back further. And then as she points her toes down at the floor, she can look down, okay? And she can go back and forth that way, getting the sciatic nerve to move backwards and forwards, breaking up that adhesion, okay? All right, thank you, Kaylee. I appreciate your help. That simple stretch on either side that you're having pain, back and forth, either sit in a chair or laying supine, laying on a table or in your bed, can break up those adhesions. So if you're having sciatic nerve pain, try that stretch out. After trying it for 3 or 4 days, if the pain doesn't subside or if it continues to persist, then you probably need to call a healthcare provider to do a proper examination to see what could be causing it. Is it a disc in the low back? Is it a vertebra out of place impinging upon the nerve? Those nerve roots that form the sciatic nerve also control the digestive and reproductive organs and can cause problems in those same areas. So we'd want to remove any interference of that nerve, any pressure on that nerve. We would want to get that off if that's what's causing it. So try this simple stretch. See if it works for you. If not, call a professional that can help you examine that, properly diagnose what's causing that. I hope you guys have a great week here. Stay warm, and we'll see you here next week for our next video.